So in previous topic, we have discussed about stunted, wasted, underweight, and hidden hunger. So let us study about the protein energy malnutrition. So two types is important: Marasmus and Kwashiorkor. So what are the difference between these two topics? Now, what is Marasmus? It is in clinical setting decreased energy intake, and time to develop is gradual, months or years. So marasmus is gradual onset, energy intake decrease, more common occurrence, edema absent, patient is active, and there is no liver enlargement. Appetite good. So in spite of this, the patient looks starved appearance, monkey faces, like thin old man, and baggy pants, skin of buttock hanging down. In lab investigation, the creatinine height index less than 60%, creatinine height index less than 60%. Early recovery, and in this patient, this type of patient is less prone to infection, and mortality also less. So diagnostic criteria of this marasmus: tricep skin fold, less than 3 millimeter, and mid arm muscle circumference less than 15 centimeter. So two important diagnostic criteria: tricep skin fold less than 3 millimeter, and mid arm muscle circumference less than 15 centimeter. So this is marasmus. So marasmus child is lean and thin, monkey faces, good appetite, and less prone to infection. It is gradual onset. So these are marasmus. Now, what's about Kwashiorkor? Kwashiorkor is decreased protein intake during stress condition. Protein index, and it is rapid onset. It is a less common occurrence. This edema present, patient looks apathetic, and there is maybe enlargement of liver. Poor appetite is poor. So these are just contrast to marasmus. Now, patient is well nourished, sugar baby. We tell that sugar baby appearance, and easy hair pluckability, and flaky paint dermatosis. Flaky paint dermatitis or flag sign will be present. Flag sign. What is flag sign? Alternate bands of hypopigmented and normal hairs. In this head, the hair is hypopigmented followed by hyperpigmented in serial order. So this is flag sign. Pitting edema present. In lab finding, total iron binding capacity less than 200 microgram per deciliter, and lymphocyte less than 1500 per microliter. So it is slow recovery, and they are more prone to infection. Mortality is high. So these two differentiators contradict with marasmus and Kwashiorkor. So marasmus child is starved look, monkey face, and this is sugar baby appearance, easy hair pluckability, flag sign will be positive, pitting edema, poor prognosis, more chance of infection. So mortality is very high. Now diagnostic criteria: serum albumin less than 2.8 gram per deciliter. Serum albumin less than 2.5 gram per deciliter, and at least one of the following present: poor wound healing, decubitus ulcer or skin breakdown, easy hair flexibility, and edema. These are all present in case of Kwashiorkor. So these are the two differences between marasmus and Kwashiorkor. Important is the flag sign in the hair. In the examination, the picture of the Kwashiorkor baby given with the hair condition. So alternate, hypopigmented, and normal flag sign. So two difference between this. There is also a picture of this flag sign. So you must show the picture in your textbook. Now, what are the acute complication of protein energy malnutrition? Acute complication of PM is SILDED. The short form is pneumonic SILDED. That is sugar deficiency, that is hypoglycemia, hypothermia, infection, septic shock, electrolyte imbalance, hypo or hypokalemia, magnesemia, dehydration, iron deficiency, and micronutrient deficiency. So these are all complications of PEM. Now, what are the age-independent indices to diagnose undernutrition? There are certain indications, Common-Age Macmillan Index, Rao and Singh Index. You need not know this. Now, what are the evaluation of malnutrition? How you evaluate? If patient comes with your setup, how you evaluate? So, most important is MUAC, mid upper arm circumference. This is very important. Mid upper arm circumference, three categories. Normal value between 1 and 5 years is 16 to 17 centimeters. 1 to 5 years child, normal value 16 to 17 centimeter. Value below 13.5 is abnormal and suggests malnutrition. So, value below 13.5 centimeter, abnormal, it suggests malnutrition. Value less than 11.5 centimeter, less than 11.5 centimeter indicate severe malnutrition. So, malnutrition and severe malnutrition. Now, there is a tape method known as Sakir tape. Sakir tape method is very important. In examination, you get the picture of the Sakir tape.
Yeah.
It is tricolor, red, yellow, and green. So, Sakir tape method, this special tab has three colored zone, red, yellow, and green. Now, correspond to less than 12.5 centimeter, that is wasted. 12.5 to 13.5 centimeter, it is borderline, and more than 13.5 centimeter normal is in case of this Sakir tape. So it is the evaluation of mid-arm upper circumference, three color Sakir tape, red, yellow, and green. Green color means more than 13.5 centimeter normal, and red color is less than 12.5 centimeter, so it is wasted. So this is very important. In examination, usually it is asked that Sakir tape is used, or another question that suppose a patient have this 12.5 centimeter MUAC, so at what color Sakir will be shown. So this is important. So Sakir test. Next is Bengal test. In Bengal test, internal diameter of the Bengal is 4 centimeter, is passed above the elbow. In normal children, it does not pass above the elbow, but in severe malnutrition, it touch. So this is just simple test. You take a Bengal, the internal diameter 4 centimeter. In normal child, in elbow, it will not pass in, through the elbow, and in malnourished side, it easily passes through the elbow. So this is Bengal test. Now, skin fold thickness. Third is skin fold thickness. It indicates subcutaneous fat. Tricep skin fold is measured more than 10 millimeter in normal children and less than 6 millimeter in severely malnourished children. So skin fold thickness is also important for evaluating malnutrition. So you see that there are three methods of evaluating malnutrition. Number one is MUAC, mid-arm, upper arm circumference. You can give Sakir tape method. Second is Bengal's test, and third is skin fold thickness of the tricep. Clear? Okay. So
yes, but
now,
it was
how
very
you
concise,
manage?
very concise. Or Sakit, there was at least one question in every year from protein energy malnutrition.
Yes, very
Irrespective of the
important.
flag sign or the Sakir tape, the question is
Either flag side or Sakir, or difference between Marasmus and Kwashiorkor.
yeah.
In which case, the question may be asked that what is the prognostic value of Marasmus and Kwashiorkor, which is gradual, what is rapid onset?
Hmm.
You know? Oh, yeah. Okay. So these are the three important. Now, how we manage the severe malnutrition? Next question is that.
Hmm.
So management, we just manage it in 10 steps. 10 steps. 10 स्टेप में हम लोग उसको मैनेज करते हैं. नाउ व्हाट आर द स्टेप्स? तो नंबर 1, स्टेप 1, we use glucose to prevent hypoglycemia. So 10% glucose used to prevent hypoglycemia. Number 2, prevent hypothermia. So kangaroo mother child skin to skin touch,
Yes.
correct electrolyte imbalance, prevent dehydration, prevent infection, correct micronutrient deficiency, initiate feeding with caution, achieve catch-up growth, and provide sensory stimulation and emotional support, prepare for discharge, and follow up after recovery. So these are the 10 steps to manage severe malnutrition. So number one is hypoglycemia, so manage by giving 10% glucose, prevent hypothermia, cover the baby or keep it in a closed room while this heat present in room, prevent dehydration, correct electrolyte imbalance, infection prevention, micronutrient deficiency prevent, initial feeding, achieve catch-up growth, and provide sensory stimulation. So these are the 10 players which were managed. So these are the 10 steps. In examination, it will be asked that what is the management of severe malnutrition, 8 step, 5 step, 10 step. These are the things. Now, how you treat the patient? This is important. Now, treatment. Treatment is very important. Now, there are different stages of treatment. Number one stage, dehydration and infection are treated during first 24 to 48 hours. Infection, dehydration are treated during first 24 to 48 hours. In stage 2, during next 7 to 10 days, patient is given a diet of 75 calorie per kg per day. 75 calorie per kg per day with F75 formula. This is important. F75. F75 formula. What is F75 formula? It may be asked that what is F75 formula? Along with antibiotic to maintain protein and energy need. So F75 formula is a preparation where 75 kilocalorie of that 100 ml of the powder contains 75 kilocalorie and 0.9 gram protein. So this is F75 diet. So in initial stage, we give F75. So 75 kilocalorie, 0.9 gram protein per 100 ml of the powder. Formula 75 diet. So this it will be asked what is F25, 75, what is F100?
F100
formula. F100 formula. So F75 हम लोग
basically F75 is 75 kilocalorie, F100 is 100 kilocalorie.
100 kilocalorie, but protein. Here is protein 0.9 gram protein.
Here. And in
F100,
2.9.
2.9, yeah, 2.9. So this is important.
There are also ingredients like lactose present, potassium, sodium, magnesium, zinc, copper.
So every micronutrient minerals present there. But this is two different products.
One important question is F75 has an osmolarity of 333. There are 333 milliosmol per liter. And F100 is 419 milliosmol per liter.
Per liter, yeah.
Per liter. So F75 has 333.
333. So it is for normal baby. When they are improving the normal baby. Now stage 3. Provide diet of 175 200 kilocalorie per gram per day in severe malnutrition. Okay. So 3 stage. 1, 2, 3. Stage 1, dehydration, infection maintain. Stage 3, during next days, 7 to 10 days, diet of 75. And stage 3, diet of 175 to 200 kilocalorie per gram per day. Okay? So this is management of protein, energy, malnutrition. So in nutshell, we finish the protein, energy, malnutrition.
Yes.
Okay?
Okay.
So another a very different condition like obesity in children. It is the protein, energy, malnutrition, underweight. Here is obesity in children.
Overweight.
Obesity in children is okay. Now, what is obesity in children? Less than 2 years. Weight for length greater than 95 percentile indicates overweight. 2 years, less than 2 years, weight for length greater than 95 percentile. But in children, more than 2 years, BMI more than 85 percentile is overweight. BMI more than 95 percentile is obesity. BMI 99 percentile is severe obesity. These are three categories.
Hmm.
And also no underweight status, BMI less than or equal to 5th percentile of for age. So this is underweight. So percentile हिसाब से है. तो हम लोग less than 2 years child, more than 2 years child. If patient less than 2 years, we wait for length greater than 95 percentile indicate overweight.
Okay.
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 Now